Thank you for the audience for dialing in to be part of this talk. So yes, I'll be talking to you about stroke, stroke awareness, recognizing symptoms and management options for stroke. Okay, so let's start with a few facts about stroke. Yeah, here we go. So stroke is the leading cause of disability in the UK, but let's first define what it is. The scientific definition of stroke is sudden onset of acute neurological deficit of vascular origin that lasts for longer than 24 hours. So in short, your symptoms come on very suddenly. It's not a gradual onset, but it's very sudden. You've got neurological problems that develop on an acute basis, and it's due to a vascular problem, and it lasts for longer than 24 hours. So that's the definition of stroke in a nutshell. Now, in terms of the burden of stroke, is the #1 cause of disability in the UK, and is the #4 cause of death in the UK. So as you can see from stroke point of view, from stroke, now as you can see, stroke survivors, which, like I said, is the 4th cause of death, but the #1 cause of disability. So those that survive stroke will have a residual disability of some sort. In terms of the incidence of stroke, 150,000 people a year develop stroke in the UK, of which 4,500 occur in Greater Manchester. Now, stroke is not a benign event, because like I said, it could 1/8 of people could have a death within a month of having had an acute stroke. Okay, and like I said, in terms of, because more and more people are surviving stroke these days, you have over 1 million people with residual stroke symptoms in the UK. That's the prevalence of stroke. Now, we've talked about what stroke is. Now, just to classify, there are 2 types of strokes. There's one that's due to a clot, and there's one that's due to a bleed in the brain. Now, like I said to you earlier, the definition of stroke is sudden onset of acute neurological deficit of vascular origin. Vascular meaning that is due to a blood vessel. So what happens in stroke is that the part of the brain that's about the stroke does not get the blood it needs to receive. Because the brain, as you can imagine, is a very, very sensitive and very, very complex organ that requires large amounts of nutrients and oxygen, which is carried in the blood. So if it's starved of blood, it's starved of nutrients and oxygen, then that part of the brain dies off. That's what causes your stroke and your stroke symptoms. There are 2 ways this can happen. A blood clot within the artery blocks the blood from getting to the brain, and then your stroke happens, or the artery ruptures and the blood spills into the brain, so you have a bleed in the brain. So those are the 2 ways that the strokes could happen, and they are broadly called either a hemorrhagic stroke, which is the bleed in the brain, or an ischemic stroke, which is due to a clot in the blood vessel. In terms of commonality, 85 to 90% of strokes are due to the blood clots in the artery, whereas 15 to 20% are due to a bleed in the brain. And like I said, when the blood doesn't get to that part of the brain, it is starved of oxygen and nutrients. And what happens? The cells die off. So you lose up to 2 million cells a minute if that interruption to blood supply to that part of the brain is not restored. So the more brain cells that die, it means that there's a greater chance of the brain damage occurring, and hence your stroke symptoms. Now, what are the signs of stroke? Now, this is a very common, public service announcement with regards to recognizing early signs of stroke. So it's called the FAST test. So the F stands for the face. What you're looking for is one half of the face lower than the other, as in what you call facial droop. Is it dropping on one side compared to the other side? Because ideally your face should be symmetrical, not lopsided. The other test, the A part of the FAST test, is the arms. Can he raise up both his arms and hold it up there? In your weaker arm due to stroke, you may have problems lifting it up, moving it at all, or if you can raise it up, may not be able to hold it for as long as the other arm that's Then also the speech. I can expand on that a little bit. Are they slurring their words? Then the T is for time, which means get them quickly to a center which is a stroke team. Because what happens is that, like I said, the longer the blood doesn't get to that part of the brain, then the more brain cells die off and the bigger the stroke will evolve. So we want to restore circulation as quickly as possible to try to salvage brain tissue and try to reverse symptoms as best as you can. Okay. I'll expand on speech later, like I said. Oh, just something to add now. So the speech not just is slurring, but then are they making sense when they're speaking? Are they talking gibberish, or are they unable to get their words out? That is all comes under speech, not just slurring, because many other things can make you slur. But more specifically, are they talking gibberish when they are speaking, or are they unable to get their words out? That is more specific to stroke. So if we move further on, now different parts of the brain control different aspects of your physiological function. So for example, vision is controlled by the back part of the brain. So a patient could also complain that my vision is blurred, or I'm not seeing for a particular eye. That could be due to a stroke at the back of the brain. You can also talk about weakness or reduced feeling, what you call sensation, one side of the body. You could have confusion. They could complain of being dizzy and unsteady, or they could also have a fall, but the fall could be due to unsteadiness or weakness. You have to clarify what caused your fall. Was it accidental or was it something else? So those things I just put all in context to say, has he had a stroke or not? Now we talk about mini stroke, but I like to go away from that term because mini stroke means small stroke. What the real term is transient ischemic attack, or TIA for short. The easiest definition I can say for a TIA is stroke for less than a day, because the symptoms you get in a stroke are exactly the same as the symptoms you get in the TIA. Difference is the timeline. Stroke symptoms carry on for longer than 24 hours. TIA symptoms tend to resolve back to baseline within 24 hours. Of course, you may hear terms like, oh, he's had a funny turn, but let's try and be more specific and use the correct nomenclature. So TIA is the correct nomenclature. Like I said, I think of it as a temporary stroke that lasts for less than 24 hours. And TIAs are not a small event. Think of it as a warning shot. Because the symptoms of TIA, the risk factors for a TIA are exactly the same as the risk factors for a stroke. And once you've had a TIA, your risk of stroke actually increases, so much so that you have a 1 in 5 chance or 20% chance of having a future stroke or a heart attack in a year's time. So if you had a TIA, it is not a mild matter, it's an emergency. Get seen by the stroke unit as quickly as possible. Now, how do we treat stroke? Now, like I mentioned earlier, with stroke, the blood supply to that part of the brain doesn't get there. So the treatment really is how quickly you can restore the blood supply, try to salvage the brain tissue, and try to reverse symptoms, but you have to be in a timely manner, because there's a mantra that goes, time is brain. So the longer you delay in treatment, or better still, the longer you delay in presenting to get treatment, more and more of brain tissue is being lost as more and more brain cells are dying off due to the blood not getting to that part of the brain. Yeah? So what you tend to do is that if you're there when the stroke happens, you have a clear onset time, you got a 4.5 hour window to get to a stroke unit, to receive medication, to try to dissolve the blood clots. And like I said, there are 2 types of stroke, one due to a clot or due to a bleed. The clot types of stroke are a lot commoner. Now, if a person has had a bleed, you're not going to do any blood thinning medication. You're going to do supportive management. But for the purpose of this talk, let's just focus on, this is a clot type of stroke. It's within a 4.5 hour window of when the stroke symptoms started. We take him to the primary stroke center where he can receive an injection to try and dissolve the blood clot. We call this therapy thrombolysis, okay? And in some cases, if there's a visible clot you can see on a scan, actually within the artery, you can do what you call removal of the blood clot, which is called a thrombectomy. And there's only bigger centers that do that. In this part of Greater Manchester, you'd have to go to Salford Royal to get that done. So what happens is like having a stent for your heart. You remove the blood clot and restore circulation. But that's only if the visible blood clot is within the artery and you're within a 6-hour window to present to get that done. Like stroke patients, as a no-brainer, should be managed by stroke physicians. So ideally, it should be on a stroke ward where you have all the stroke personnel available. So the doctors, the stroke-trained nurses, stroke-trained therapists, be it physiotherapy, occupational therapy, special language. So ideally, should be in a stroke bed base, in a stroke hospital, being managed by stroke specialists. And you find that they tend to do better because the stroke management is not just medical, but also rehabilitation. And early rehabilitation, if it's instigated early, they tend to do better. And of course, this journey does not end once you're discharged from hospital, because like I said, over 1.2 million people are living with stroke symptoms, and so many people have residual symptoms from their previous stroke. So they need community support for when they leave hospital because they have to function. Because with stroke, you've got some limitations from the stroke. So you have to learn to function within your limitation. Life does not end because you've had a stroke. It's not a question of having to live within that limitation that the stroke has conferred the patient on, or with, rather. Now, what advices are there? So like the Stroke Association, brilliant organization. They give you advice, information, supportive therapy, and people to help to counsel you. So it's a brilliant association and lots of information as to what's going on with stroke. Information about therapies, it's a really great website. So get in touch with Stroke Association. Now, sometimes with the stroke, the support could also be social input. If someone is quite disabled from the stroke and cannot actually function in his old place, we have to talk about placement. We can talk about having carers or adapting their living to suit their new living conditions. So that's the equipment and the aids just to help them to function. Of course, emotional support, because depression is not uncommon in stroke patients. Because when you think about it, stroke is a sudden onset illness. So 1 minute you're perfectly fine, going about as normal, then in a split second, everything changes. So no doubt people's moods will take a hit if they've had a stroke. Of course, peer support groups, because the families, yes, are there, but it can be quite overwhelming because let's not forget that the families still have to deal with the burden of the illness. But groups and peer support, people who are going through the same thing as you, also helps. Now let's talk about causes of stroke. So there are many, many causes. I'll put them into two groups. There's the causes that you can do something about, and there are the causes that, unfortunately, you can't do anything about. But some good news is that the causes of stroke that you can do something about carry more weight. So don't think that because there are some risk factors out there that you can do nothing about, therefore carry on as not as you like because you can't change this. They carry less weight than the causes you can do stuff about. So in terms of, let's start with the causes that you can not change. Aging, the body can grow younger, you can only get older. As you get older, your risk increases, okay? And we've got two definitions of age-related strokes. We've got our old strokes and our young strokes. So I want to debunk a myth. People always assume that stroke is an old person's illness. It's not true. Even here in Greater Manchester, I've seen a stroke patient who was 19 years old. So it can happen in a younger population, but they have other issues going on. So by definition, a young stroke is a stroke that's happened in a less than 65-year-old individual. The majority of the strokes, yes, happen in the older population. Like I said, aging, you cannot do anything about. Gender, you cannot change. So obviously, strokes are commoner in men compared to women. But once the women hit menopausal age, the incidence is about equal in both men and women. So obviously, you cannot change your gender, really. Then other non-modifiable risk factors, this is where it gets interesting, is your ethnicity. Strokes are higher in the Black ethnic groups. The Caribbean and African ethnic groups have a higher incidence of stroke compared to their Caucasian neighbors. Also, Southeast Asians, people from India, Pakistan, Vietnam, Nepal, for example, also have high incidence of stroke compared to their Caucasian counterparts. So really, you also cannot change your race. These are the non-modifiable risk factors in a nutshell. Now, the risk factors that you can do stuff about, which is the modifiable, include things like your diabetes, having good blood sugar control, hypertension, controlling your blood pressure, not letting you run sky high, having high cholesterol, having sickle cell disease is well managed, obesity, smoking, alcohol excess, illicit or recreational drug use, and also what you call atrial fibrillation. These are all modifiable risk factors in that you can do something about it, okay? And these ones carry more weight than the other risk factors we talked about, the ones you cannot do anything about. So if you can reduce these risk factors and manage them, you greatly reduce your chance of suffering a stroke. This is what I can tell you. If you're a smoker and you stop smoking, your stroke risk automatically reduces by about 50% just by stopping smoking. If you're overweight, losing weight helps. Cholesterol, blood pressure, diabetes, atrial fibrillation, and the right medication, they all reduce your risk factors greatly cumulatively. We talked about ethnicity earlier. So like we said, Black people are twice as likely to have stroke compared to their white counterparts. And these are some of the reasons that they postulated, because diabetes and hypertension are commoner among the Black people, and these are major risk factors for stroke. So if you have any of this, we have to take this thing seriously. Now, what can stroke do to you? We discussed about the symptoms earlier. Different parts of the brain control for different functions of the body. So vision, speech, language, which includes expression and understanding, smells, being aware of the environment, concentration, higher function like mathematical skills, learning a language, studying, learning a trade, all these various aspects, memory, are controlled by different parts of the brain. So depending on when the stroke happens, you have symptoms that could affect any of these functions. Now, this is just like a sketch of these common symptoms you expect when someone has a stroke. So limb weakness is, whether arm or leg, is quite common. Visual problems is common. Facial droop is common. Now, aphasia refers to higher function of speech as higher function, which is either the expression of your words or understanding of things. That relates to aphasia. So in aphasia, either comprehension or expression is affected. Slurring of speech is totally different. That has to do with a mechanical problem. You could have what you call inattention, which means that one half of the body they prefer to focus on, and the other half they ignore. Yeah, they ignore the half of the body that's felt the stroke. That happens in about 20% of cases. Now, emotionalism, like I said, because your mood will take a hit. Remember, stroke is a sudden onset. 1 minute you're fine, split second you've got your symptoms, your mood will take a hit. You find that they are quite up and down with their emotions within 6 months or even after 6 months. Sometimes you could just be carrying on. Post-stroke depression is not uncommon. Now, going to the symptoms broadly, obviously, if you've got limb weakness or incoordination, it can affect your walking and it can affect your balance and your coordination. Obviously, and also if you've got visual problems, it can affect your walk. You could be bumping into things. You could have lack of awareness of your surroundings, so you're bumping into things. The swallow could be affected too much so that you're either having a tube to feed you or your nose or other means of feeding you if your swallow is unsafe. You have lots of bowel and bladder control, so you're incontinent. So like I said, all these things too can also impact on the patient physically, and also psychologically, thereby affecting their mood. Now, just to recap some take-home messages, a stroke or a TIA is not a mild thing. Yes, stroke mortality has gone down, but disability from stroke is still top of the list. So it's better to prevent it. A TIA, if it happens, is not a benign event. It could be a warning shot to a major stroke. So if you experience one, you should present and have it looked at. If you see any of the signs of strokes we talked about, whether the first symptoms or vision or incarnation or speech problems, dial for the ambulance and go straight to a stroke center to be assessed. Just another thing, like I said earlier, time is brain. The longer the reperfusion, or rather restoring circulation in the brain takes, the more brain cells are dying off and causing more strokes, causing more severe stroke. You need to act quickly. First, present quickly, and then act quickly once you present early enough. And regardless of COVID, if you've had a stroke, the best place to be is in the hospital, not at home. So you can be looked after by the stroke specialists in their bed base. Let's talk about Fast Positive. And these are some of the websites. So this is the Stroke Association website that you should please look into. And they talk about stroke in detail. So if you bear with me a second. So I'm just going to go to another slide just to show you some stroke images and to do some patient case discussions, if you bear with me. So I'm just going to reshare another slide with you. Screen. Okay, so let's go to this one. Now, this is an 82-year-old man who was seen well the day before he presented. So unfortunately, he didn't present as they presented a day late. He has a background of a previous heart attack. He has hypertension. He's had heart bypass surgery, high cholesterol. He's got atrial fibrillation. He's got kidney problems, and he's anemic. And he's 82 years old. He's a man. Not all his background, yes? Now, the next morning, when he was found, he was half out of bed. His left side of his body was very, very weak and was slurring his words. When he was examined further, he was preferring to look to his right side, so was ignoring his left side completely. The left side of his face was droopy. His left arm and left leg were very weak. Like I said, he was favoring his right side compared to his left. So he was neglecting his left side. So that's how he presented, and that's what we found when we examined him. When we did a CT brain scan, I don't know if you can appreciate my cursor. If you follow my arrow, what you're looking at from here to all the way here, all the way here, all the way here, all the way here, down to here. So this dark, well-defined area looking at on the right side is a stroke. So this gentleman had a very, very large stroke on the right side of his brain that caused very severe symptoms that he presented with. This is an example of what a stroke looks like. And this is the clot type of stroke. There's no bleed on the brain. So this is the clot type of stroke that he had. I'll show an image of someone that's had, bear me a second. A bleed in the brain. Okay, here we go. Now this is an example. I don't know if you can see this. Now what you're looking at here, these white bits you're looking at, all that is blood. This gentleman had a very large bleed in the right side of his brain. So his stroke was a bleed type of stroke. It's quite a large one. And this again. Okay, and we're done. So that's our talk in a nutshell. I hope that was very clear to everyone.
Yeah, thanks a lot, Doctor, for sharing that and for explaining. So before we get into question time, I think we have Becky on the call as well from the Stroke Association, and she has a presentation to make, and then we'll go into Q's and A's.
Okay, no problem.
Okay, over to you, Becky.
Thank you, Charles. Hi, everyone. My name's Becky Begum, and I'm from the Stroke Association. I'm going to apologise in advance because I've got my 2-year-old in the background and I've got no one to look after him. So you might hear him come through in a bit. I've just got a brief presentation and it follows on from what the doctor was talking about and sort of life after stroke. So I'm just going to share my screen with you so you can see the presentation. I can't present until whoever's present. Fab. Let me try it now.
Could Becky be made co-host at the BNP?
Let me try now. Can you see my presentation?
Yes, I can. Yeah.
Yeah.
Yes.
You can. Fantastic. I'm just going to play a little video to start off with, and I think this encompasses what we're talking about when we talk about stroke and how it can affect anyone and everyone.
So I was in work, it was a Friday.
7th birthday party.
There's something not right and I start to panic.
My mind was not coming together.
I can't move my right hand side. Massive shock of explosion.
My brain fell out.
Thought I would die.
My body drained. And then I disappeared.
Woke up and everything was spinning.
The light was like needles. Your life is in a trap.
Over time, it's getting better.
Hopefully some of these fingers might work again.
Every day is a challenge. You need that extra support to get you through.
I'm Baz. I'm Paul.
I'm Luna. I'm a stroke survivor.
I am a stroke survivor.
I'm Alicia, and I'm a stroke survivor.
I wanted to start with that video just to demonstrate how stroke affects anybody and everybody, and the way it affects people is very different. So the doctor went through some symptoms that you might have when you're having a stroke, and that's very unique for different people. So there are some symptoms that are very common, and we talked about the FAST campaign, but there are some where it might be different, it might not be what you're thinking, and what it feels in your head can be very, very different. And I think that video just shows how it affects anyone and everyone, and it can absolutely destroy lives. And one of the things that we do at the Stroke Association, our key message is about rebuilding life after stroke, and that people can have a quality and meaningful life after stroke. The doctor touched on about how stroke was thought about being a older person's, and it only happens to old people. But what we do know is it's affecting younger people, and there's about 400 children in the UK that have a stroke. And I think the other key thing is Black and South Asian community have a higher risk of having a stroke, and it affects them at a younger age. This is Alicia, and I'm going to share Alicia's story with you. She was only 26 when she had a stroke in 2016, and she was a primary school teacher. Her stroke left her unable to read, write, or to walk. And we're just going to talk a lot about how it affected Alicia and how she rebuilt her life after her stroke.
I know lion, giraffe, elephant, rhino. That's a tricky one.
Your life.
My mind was not coming together. Inside, I'm stuck.
Inside.
Frustrated, it's not because anyone's done it, it's just because I can't say it and it's not coming out.
Bench.
It begins with
S. So what is that? 5 letters.
I think it was when I was at the rehab, they must have mentioned aphasia. Now what I know at this point, what aphasia means, you're intelligent, but you do have to start from the beginning. I didn't really understand this is a stroke. The doctors were coming and saying, you might not wake up, you might not be able to talk, you might have a wheelchair, it could be quite severe. I was a teacher for 5 years and that was honestly my passion, but it took a long, like a year to accept that, no, I don't think I can be a teacher. I guess you really try your best. I smile, but I do have a lot of tears or upset or worried. I guess anxious.
They don't really tell you that this is going to be an ongoing thing for the rest of her life and your life.
Because sometimes I feel that I'm in my own world, while everyone else is moving on. This is a scrapbook, all my memories. The reason why I kept it is because, like, look at this before, how severe it is, but now it's, I guess, better.
Try to remember how far you've come.
Exactly, yeah. I'm just trying to think about, like, when I have the sad things, what will I do to make it better? Football.
Yeah, but the Americans might
Soccer.
Oh,
Football.
actually, they did call it football.
I don't think you know how to do speech and language. I'm really happy with this new things I'm doing. Like, I've accepted that I'm not a teacher, but I am a teacher because I'm volunteering. I think everyone can do anything they want to do. Might take time, but I believe you can do it. Stand up and don't give up, whatever you want to do. I feel so grateful that the Stroke Association has really helped us so much. You get to meet new people who have had a stroke, but now I am volunteering for the Stroke Association and I honestly love it. You have to think that we are alive, but how can we help others now? We're lucky. We have to remember, imagine that point. I thought I was going to die. They said that, but now I'm here today. I can walk, I can talk, I can learn, I can do so much. Like, it's just, yeah, I guess I'm quite grateful and blessed in that sense.
I wanted to play that video because I wanted to demonstrate how you can have a very severe stroke and it can absolutely affect your physical ability, but there is life after stroke and people can make very good recovery with the right support and with the right intervention. So what is it that we do at the Stroke Association? We do a variety of different things. And the two key that I'm going to talk about today is the stroke support services and research. So we have support services that will absolutely try and help every single stroke survivor there is to rebuild their life after stroke. We provide specialist information about stroke. The other bit I'm going to talk a little bit about is research and the different type of research that we fund. And we also fundraise and we campaign. So what is our stroke support services? The doctor touched on this very briefly around peer support. One of the things stroke survivors tell us is that peer support is absolutely crucial to recovery. The care that they get in the hospital is fantastic. Having specialist support from professionals is really good. But one thing they benefit is talking to other stroke survivors and how other stroke survivors have overcome their difficulties. Carers tells the same thing. Carers find it really helpful and form a bond to talk to other carers and discuss, what is it they're struggling? What is it they're finding difficult? How long did their recovery take? How did it affect different people? So we have a volunteering service where stroke survivors are matched with other stroke survivors and they can talk about that. We run a variety of clubs and groups, and these vary. We've run all different sorts. They can be from coffee mornings to art groups to walking groups to exercise. It just depends on what the people in that area need. We have a national stroke helpline, which is open Monday to Saturday, and people can ring that to get advice. We also have the stroke recovery service, and I'm going to talk a little bit about that one. We've just started a new program called Stroke Connect, where anyone that's had a stroke can get passed on to by the hospital, and we will provide some support to them. And the other one is My Stroke Guide, which is an amazing platform. It's an online tool where there's forums, there's videos, and there's over like 200 videos, and they're really good videos because when you've had a stroke, sometimes you don't think about how am I going to do something. So if you've got right-handed weakness, how are you going to brush your hair? How are you going to use a hairdryer? How do you cut a potato? And there's lots of tools on there with therapists that I've designed to give tips on how to manage all those different aspects of how a stroke might affect you. In the Stroke Association, we have over 280 stroke recovery services. And what we do is we work with the NHS, we work with the clinical teams, we work with the community stroke teams to provide a coordinated support to make sure that you are getting the right support at the right time from the right people. We look at all your needs, not just a stroke, but look at how everything's affected you. So we look at your social, your emotional, your housing, how things are going. We help you to self-manage and understand what's happened to you and how you can take charge of your own recovery. We promote independence and support carers. We've talked a little bit, and we saw with Alicia, at least 1/3 of people who've had a stroke will have some sort of communication difficulty. And that might be how to talk, how to read, how to get your words out, or how to understand someone else. And if you think about it, if you've lost your ability to communicate with people, that can be a really frightening and lonely place. And that's something we will support with. The other key thing is emotional support. Nearly every person that's had a stroke will have some sort of emotional need, whether that's low mood, depression, anxiety, and we will support them through that. The other one I briefly wanted to touch on was research. And the reason I want to talk about research is because without research, we wouldn't really know how to help stroke survivors. We wouldn't really know what intervention to do with stroke survivors. So stroke research is chronically underfunded, and our stroke research allows us to find new ways of stopping a stroke happening, improving treatment, and we mentioned earlier at the start, there's more people surviving a stroke, and that is because research has gone into that to look at what kind of intervention will help people survive a stroke. And once you've had that stroke and you've got a disability, what intervention is the best kind of support to help you overcome that disability, as well as long-term support, including emotional. Since 1990, the Stroke Association has invested £56 million in stroke research. The two new projects I really briefly wanted to mention was, does COVID-19 increase the chance of having a stroke? And if so, how? And for who, when, why? And it's looking at all those different factors to see why COVID-19, why COVID-19 might increase the chance of having a stroke. And the other one is, we talked a little bit about there's two different types of stroke. You can either have a clot, which is the most common one, or you can have a bleed, which is less common. But because the bleed is less common, we don't know a lot about our bleed. We don't know much about how to treat it. We don't know much about how it affects people. So there's also, we're funding one now looking at a treatment package for stroke caused by a bleed in the brain. Since sort of the 1990s, we've come really, really far with stroke. More people than ever are surviving a stroke. The FAST campaign is great, and we know whenever we run the FAST campaign on TV, on the radio, there's an increase of people getting 999 phone calls. We've supported over 57,000 people with our services. And just very recently, we worked with NHS England on a new national plan for stroke, and that will improve stroke care across the whole pathway from the moment you call 999 up to however long you need us to help you with your recovery. So even though we've come a long way, there's still a long way to go. It's predicted that by 2025, the number of strokes, people having a stroke, will be increasing. I've talked a little bit about research and how that is massively underfunded. And to put that into context, only £48 is spent on stroke research, while for cancer is 241 and for dementia is 118. So you can see a massive difference in how much money is spent on research. 45% of stroke survivors tell us that when they leave the hospital, they feel abandoned. They feel they've got no one to ask their questions to, no one to support them. And we're not reaching everyone we can. There's only a small percentage of people that we are reaching. There's just one more story I wanted to share with you, because Alicia's story talks a lot about how it affected. Yeah, just wait 1 second. Alicia's story talks about how her stroke affected her physically. Baz's story will talk about how it affects him emotionally, because an emotional part is the massive part of stroke.
Went to bed about 10 o'clock, fell asleep around about 20 past, woke up 7 minutes later, massive excruciating pain. It was just...
Oh no! Oh no! No, I did you. Oh no!
A few weeks later, I went all my friends to work. My girlfriend went to work. I was in...
Oh.
Went to bed about 10 o'clock, fell asleep around about 20 past, woke up 7 minutes later, massive excruciating pain.
I need you to now.
Oh, nightmare. A few weeks later, when all my friends went to work, my girlfriend went to work, I was in a wheelchair and I decided to kill myself.
No.
I thought that there is nothing on earth that's going to rectify this. It's going to make this better. I just let the door open and dragged myself across the ground to the deep end of the swimming pool, which is about 1.5 meters deep, and plopped straight in. And when I actually fell in and hit the bottom, looking up and everything spinning, I said to myself, what have you done? Fortunately for me, my girlfriend came back in the afternoon. She ran straight through and she dived in and she got me out. It wasn't because of her, well, Begum. I had to do that, think about this, and I was just concentrate on one aspect, one movement only for weeks until I could master the movement and practice like knocking a basketball against a wall or a small ball. And I would do that for weeks, just a movement for each. Knocking the ball only for inch by inch by inch and inch. And then when I could go back, maybe a couple of feet, move the basketball. And I think, yes, progress. Basically, from 1992, 30 years ago, I've gone from not being able to speak, not being able to see properly, completely paralyzed. I can't do virtually anything now. After my stroke, there is no way now I thought ever that anyone I could fall in love with, someone could love me and then be married or have kids or whatever. I thought, no, that's it. That's one of the reasons why I wanted to kill myself. Very good, very good, excellent. But did I just hear a mistake in there?
Nah, it's meant to be.
Sure.
It's meant to be.
Really? The Stroke Association did actually make me feel more more alive, basically, instead of just alone. I knew there's someone at the end of the phone if I wanted to speak. It is possible to come back from stroke. It does take a long time. For me, it took a long time, but it is possible.
I think that my dad's got, like, I don't know, something about him that's really special, but I can't really put my finger on it. I can't really say exactly what it is. But I think, I don't know, he's just special in a way. I'd say in a way he's a superhero. I think he's really, really cool. I think he's like, he's everything that I want him to be, basically.
For me, Baz's story just demonstrates how stroke can absolutely affect everyone in the family, and it takes a long time to recover from a stroke, and acceptance and emotional is a key part of that. How can you help? How can you take action on stroke? So if you fancy volunteering, you can look at our website and see what opportunities are available. You can share on social media, you can share posts or campaigns, or just raise awareness of strokes. And the other thing, which is a key thing, is influencing, telling politicians, telling commissions why it's important that stroke needs to be a priority. And that's the end of my presentation. Thank you very much, everyone, and apologies for the child.
That's okay, Becky. Thanks. So we're going to bring, the doc and yourselves. I wonder if people have any questions. Any questions for, Dr. Azubike or, Becky? I know, yeah, I think from both of your presentations, you mentioned people from Black and ethnic minority backgrounds, having been more at risk. And I wonder why that is the case. Is there anything about genetics or genes, or why is that the case, Doc?
All right, so genetics could no doubt play a part in it, because certain illnesses are prevalent in the Black community and South Asian communities. And also, when you think about it, another simple explanation could be the risk factors that we have in the community. Hypertension, high cholesterol, and diabetes is quite more prevalent among Black people. And these are major risk factors for stroke and heart disease anyway. So it stands to reason if you have more of the risk factors, then obviously you have a greater chance of developing a stroke. That could also play a part in why you see strokes more common in these communities.
Thanks, Doc. Becky, anything you want to add before I bring in Doreen?
No, I think the doctor's touched the key thing. I think it's the fact that we have higher risk of diabetes. There has a high risk of blood pressure, and those are the key things. There might be other things, but there's not been enough research done. Okay, 1 second. The thing is, there's not been enough research done to understand why Black and ethnic are more risk of stroke. So that's why research is a key part to understand, because if we can understand why people are at higher risk of having a stroke, then we can put preventive advice or treatments in place for that.
Thank you. So I'm going to bring in Doreen. Doreen, if you can unmute yourself.
Yes, I'm unmuted, and that was going to be my question, actually. What could Black and ethnic minority people do to mitigate the incidence of stroke? But I just heard Becky say that, there's not enough research, because people talk about lifestyle and diet and things like that. But I mean, not everybody in the Black community who has a stroke has a bad diet or has a bad lifestyle. So I just wondered, if there was anything else that they could pinpoint on. I have to add that in my family right now, I've got 2 siblings who had severe strokes. A young sister in her 50s and a brother in his 60s. And both have had very, very severe strokes. And I don't understand why. And the other question that I wanted to ask Becky was, Baz said that his recovery was a long time, and I wondered how long was long.
A long time can be a long time, Doreen. Just give me 1 second.
Okay, Doc, over to you.
Okay, so like I said to you earlier, there are many risk factors for stroke. So diet and lifestyle is just the tip of the iceberg. Other things that could be going on. I mentioned diabetes, high cholesterol, previous heart ailments, like previous heart attack. Have you had heart surgery in the past? Then also we talk about atrial fibrillation. Is your heart beating in a regular fashion? So when somebody has had a stroke, you do a proper stroke workup, because what you're looking for risk factors you can address. Like I mentioned, all the risk factors that you can do stuff about, which are your modifiable risk factors. Obviously, and also things like smoking, drinking excess alcohol, recreational drug use. These are all modifiable risk factors too. Any structural problems. So there are different things you look out for when you've had a stroke to investigate. So I do sympathize that you've had 2 siblings who've had strokes. I believe that given their young ages, it have been investigated thoroughly and risk factors addressed. I could have answered the questions why their strokes happened.
Yeah, because neither of them smoke nor drink excessively, you know, and definitely for my sister, I know that she's very much into healthy eating.
Yeah.
But one of the things I know that she traveled a lot, so I just wondered if that might have had anything to do with it, but I really don't know.
No, traveling wouldn't, but having said that, was sister hypertensive by any chance? She have high blood pressure?
No, neither of them, I wasn't aware that either of them were hypertensive. So it really came as a tremendous shock. But I do know that my sister had DVT at one time. So that's why I said I wondered if that had anything to do.
That's a possibility, because when you have a DVT, it means they are prone to developing clots. And we have 2 types of strokes, the clots type and the bleed in the brain type. We started a previous DVT, which means that she's pro-thrombotic, which means she can develop clots. Then possibly that could have, she has an underlying risk factor for her stroke. So possibly, but I said, at the time, they should have been walked up to find out her various risk factors. They have looked at her heart, done a series of blood tests and different scans just to see, okay, what could have caused this stroke? So they're just focusing on one thing. They're trying to address all your risk factors and minimize them as much as possible. I mean, based on what so it's hard to say exactly what caused her to have a stroke, but I believe it should have been investigated at the time when her stroke happened. The question of what was found at the time when she was treated for her stroke.
I think sometimes, Doreen, it's acceptance is really hard, because when your lifestyle is quite healthy and you don't smoke and you don't drink and you don't have high blood pressure or diabetes, and then you have a stroke, that can be really hard, because there could be other things that's caused that stroke. But we don't always know what it is, because there's so many different things that can cause a stroke. So sometimes it could be a medical thing that's caused it. Something we've not touched on a pot. Sometimes you have a hole in the heart, and that's not always routinely picked up, and that can cause a stroke. So there's so many different things that can cause a stroke, and that's why it can be really hard to say sometimes that is what caused a stroke. And when you don't have a reason, it's really hard to accept it as well, because you're always wondering, why did I have that stroke? You know, I try and be healthy. I don't have high blood pressure. I've just noticed someone put in the chat bar, can stress be a factor?
Oh, yes.
I think, again, it goes to research. There's no concrete research, but yes, people will suggest stress can be a factor, because when you're stressed, you might have high blood pressure and you might not know you've got high blood pressure, because high blood pressure, we call it the silent killer. You can have high blood pressure and never know you've got it unless it's ridiculously high. Sometimes you might not even know you've got high blood pressure. So stress can be, and then obviously when you're stressed, you might start eating unhealthily, you might start drinking more, you're not sleeping properly. All those things can take into effect. Just to go back to the recovery, Doreen, recovery can be a long time. It's not like a broken arm. Sometimes people say, well, if you have a broken arm, your bone fixes itself and in 8 weeks' time, you'll be okay. With a stroke, there's the physical aspects of it. So sometimes someone will never, ever go back to the way they were. But that doesn't mean they can't have a meaningful life. So we saw with Alicia, she couldn't go back to being a teacher because of her problems with the speech. but she still has a very meaningful life because she still volunteers, she still sees herself as a teacher, and it's about having that quality of life. It can be 2 years, it can be 5 years, it can be 6 years, because there's different aspects of it. There's the physical side, and with physical side, you'll get to a point where you can't recover anymore. And with stroke is quite amazing because the brain can sometimes, after 2, 3, 4, 5, 6 years, we call it neuroplasticity, where the brain, you recover, and then you stop recovering. And then after, no one knows, you can't put a time for it. It might be 2 years, it might be 5 years, it might be 6 years. The brain starts building new connections again. And when it starts building those new connections again, sometimes people say, oh, I started recovering again. I stopped and then I started recovering again. And that's because your brain's building those connections again. But I think what Alicia's and Baz's story showed is there's that determination to get better. There's that, optimism, being stimulated. We know, I think the lockdown's shown us, if you're not being stimulated, if you're not having social contact, you decline, your mental health declines, your physical health declines. So it's really important that you have those connections with other people to have that peer support around you.
Right.
And then there's the emotional side. It can take a long time for you to sort of accept you've had a stroke, or the low mood, the depression. That's why it's really important people work together around the whole family unit.
Well, my brother is still in hospital after about 5 weeks, I think, because he had no mobility, no speech. And I know this is controversial, but his children feel that it was just after he had his second vaccine that he had the stroke. So, I know no doctor will admit or, anything to that, but that's our experience, really, because we had no idea why this has happened. I wasn't aware of him having any high blood pressure, but as you said, sometimes people have high blood pressure and they don't know. He was healthy, as far as we always saw. It was just weird.
And that's why research is important, because when you have a small number of cases, so people say, well, he had a stroke after his first or his second vaccination or after COVID. When you have a small number of cases, you don't know if that's because of COVID or something else. So you do need to look into that properly before you make those judgments.
Absolutely.
And if that is the case, if there is a link between COVID and stroke, it's understanding what that link is. Who does it affect? Is there other people higher risk than others? Why does it affect people? How does it affect people? And when we can understand that, then we could start talking about, well, how do we prevent people from having a stroke due to COVID?
Yeah, I understand. Thank you.
Can I bring you in, the question about the stress and also the, vaccine, because what we know are people, having blood clots and all that. And I wonder whether there is something you want to say to that effect.
Okay, I guess it's purely anecdotal. There's no evidence whatsoever that the vaccine causes stroke. It could just be crazy, because stroke, like I said, does not give any warning sign. It can happen to anyone and it's sudden onset. It just so happens that, you had your vaccine, had a stroke. It didn't cause it. It was just coincidence. So there's no clear evidence that the vaccine causes stroke. So I don't think there's any link between both at the moment. And what was the other question you asked?
I think about stress, whether stress could contribute.
Okay, yes. In fact, I see that Zaid has two questions. First is it hereditary, and it could just be a factor? But let me just expand a bit more on stress. Stress is not a direct cause of whether stroke or heart disease. It can have its effect indirectly in the way you react to the stress, because everybody deals with a certain amount of stress. Because too much stress is no good. But how do you react to it? Not merely being stressed will not cause you to have a stroke. Like Becky said earlier, stress can have different physical function reactions to the body. It can jack up your blood pressure. It can give you like an adrenaline surge. It can set your heart into overdrive. There's many things stress can do. Stress can lead to depression and comfort eating that can make you obese, which itself is a risk factor for stroke and heart disease. So it's quite an indirect risk factor rather than direct. So merely being stressed does not mean that you're going to have a stroke or heart attack because you're stressed. It's the indirect action of the stress that leads to this event. Now, is it hereditary? No, it's not hereditary, but there's an increased risk of stroke if a close family member has had a stroke. So that's one of your non-modifiable risk factors. So if your parents or a sibling has had a stroke, you're at greater risk of somebody compared to somebody with a zero family history of a stroke. I said the reason for that is not clear-cut, but it's documented that family history confers you to a slightly larger risk compared to somebody with a zero family history. So it's not hereditary.
Thanks, Doc. Yeah, I mean, the other question is, what can we do to support, someone? I mean, from the videos that have been showed, recovery could be very long. And I wondered, what can we do, to support people to live, a close to normal life?
Okay, like I said, with stroke, I always tell families and the patients, it's not a sprint, it's a marathon. It's a very, very long road. It is a hard road, and it's both telling on both the patients and their families. As I said, it is quite a long road. And other things to worry about, apart from the physical aspects, there's emotional aspects, and also the patient has limitations from the stroke, but you still have to function. So obviously, rehabilitation plays a very key role in helping them function within their new condition of the stroke. Some make good recovery, some have stalled recovery, and some, they're actually quite at the far end of the spectrum where, that's it pretty much. Like I said, every individual, every patient is different. One glove doesn't fit all. And of course, places like Stroke Association, with the peer supporting and the other things that they do, is very helpful. Counseling for the families too is also warranted because it also takes its toll on the family, like I said. It's not looking after a loved one and it is demanding. So like I said, it's all hands on deck. It's a long road. Pace yourself. It's not a sprint, it's a marathon.
I think the other thing I'd add into that is, because it affects the whole family unit, and we've said it's very quick, it happens with no warning. So sometimes, families find themselves being a carer before they weren't expecting to be a carer, and suddenly overnight they become a carer and they're looking after someone who might have quite demanding physical needs, or someone who's emotionally changed quite a lot. And it's about being kind to yourself, and it's accepting, this has happened, and how can I deal with this as well? As a carer, it's okay as a carer to feel frustrated, to feel angry, to feel sad, to feel like you've lost something. And it's important that as a family, you're supported as well. So you've got the stroke survivor who absolutely needs care and support and the physical rehab, whatever it is they need. But then you've got the carer's family who need, the carer needs supports and understanding, finding out information if that's what helps you, because different things help different people. Some people want all the information then so they can process it and they can have an understanding of it. Some people don't want that information straight away. It's too much, and people will hit different points at different times. So when you're ready, that's when you'll sort of feel like, okay, I'm ready for this. And that's what my next stage is. And that's what I'm going to find out. Being understanding, if you've got a family or a neighbor or someone who's had a stroke, see how they're doing, see how they are, see, if it's very in the early days and they're quite restrictive, can you look after that person for an hour while they nip out and have a bit of time to themselves? Because emotionally it can take a role on everyone. I think the other thing is, I don't know about the Black community, but I know in the Asian community, there's quite a few different myths about sometimes why a stroke might have happened or some of the things that you can do. And I would absolutely advise you, before you do something, go and speak to a doctor, go and speak to someone you trust and see if what that myth that might be circling in that area is the correct advice or not. So I know from my experience, sometimes when a stroke happens, people say it was God's will, it's happened because of that. And it might have been God's will, but that doesn't mean you still can't have help and you can't support that person and you can't put the things in place for that person. So I think it's about going to people you trust in your community to get the right medical advice rather than just assuming certain things happen or cultural beliefs.
Yeah, thanks for highlighting the faith bit, Becky, because on Saturday we were looking at faith and health, and one GP who is also a pastor was talking about one time his congregation member calling him, and what what she was talking about, the way she was feeling for him, those were signs of stroke. So instead of asking for prayer, I mean, yeah, him starting to pray, he asked her to call the ambulance. So I wonder, Doc, whether you could recap on, what are the signs we look out for, in order to take action.
Sure. So I expand a bit on the FAST campaign, which is a quick assessment, but there are other symptoms as well. So if you start simply, so when you look at the face, is the face lopsided on one side, what you call a facial droop? The one half of the face lower than the other. Then you can do the arms test. Can they move a particular arm as well as the other arm? Can they move it at all? Can they move it minimally? Or if they're able to lift it up, can they hold it up? So you want to assess for arm strength. Then also you want to assess for their speech. Are they slurring their words? But also expand further. Merely slurring your words, there are many causes of that. But I want to expand speech to include, are they talking rubbish? Are they talking gibberish? Are they not making sense? Just uttering senseless talk? Or are they unable to get their words out fully? So that's also includes in speech. Then other symptoms you can look out for. Are they complaining that one half of their vision is gone? They can't see clearly in one particular eye? Do they feel like they're unsteady or incoordinated? Then if you notice any of these symptoms, when it happens, call the ambulance straight away, because then you need a clear, because like I said, with the strokes, when they happen and their weakness happening, go to a 4.5-hour window, get them to the stroke unit so they can have what you call the thrombolysis therapy, where you give the injection to bust the clots and reduce the, restore circulation. But that is only if the stroke is due to a clot type of stroke. If it's due to a bleed, there's no clot busting medication to be given. That treatment only applies to if it's a clot causing the stroke. And rule of averages, 85 to 90% of the time, your strokes will be due to the clot type of stroke. Okay, and that is when you have that 4.5-hour window to act and restore circulation, to try to see if you can restore some symptoms back. So that's what you look out for really as a stroke happens.
Thanks, docs. Someone said, I do wake up and sometimes it feels like one hand is frozen, or should I be concerned?
Well, it depends on what you mean by frozen hand. Now, did you sleep awkwardly on the hand? Does the hand restore back to normal? Like I said, with stroke, as you defined it at the beginning, your symptoms was sudden onset. There's a clear deficit in how your hand, your whatever functions, and then does it last for longer than 24 hours? If it gets back to normal rather quickly, it's unlikely to be a stroke. It could be anything else mechanical, or it could be a TIA. But stroke symptoms are very specific. Like I said, they linger on. They don't get better so quickly. So if it's a question of, every time I wake up, it feels a bit frozen, it doesn't mean that it's lying awkwardly. It could be arthritis, it could be anything. Not necessarily a stroke, so I wouldn't worry so much.
Is it worth mentioning about TIAs, doctor, then to talk about, how, so a TIA by definition is you have a stroke, but the symptoms resolve itself within a certain amount of time. So if anything the doctor describes, if you find that you do have facial weakness, or your speech is blurred, or your vision's affected, the other one is headaches, you seem to, and headaches is a bit of a tricky one because it can be migraines or something else. But if you get something like that and you're like, oh, that's very strange, that's just happened, it is worth getting checked out, because a TIA, someone who's had a TIA, is at higher risk of having a stroke. People who have a TIA tend to go and have a stroke, so it is worth checking that out. But it's not something that will happen all the time. So it's not a symptom that you will get all the time. It's something that might happen and you're like, oh, that was really, really strange, but it felt funny. It's always worth getting that checked out.
To clarify, I did talk about TIAs earlier, but Charles's comments, he wakes up with this every morning, so that's unlikely to be a TIA. So after that's why I didn't mention TIA at all. But just to clarify the difference between both, the simplest way to define a TIA is a stroke for a day. It's not resolved within a day. And in fact, they start to get better almost immediately. They have to wait the full day for it to restore back to normal in most cases. But the stroke symptoms do not improve and they linger. But if you wake up every day with frozen arm, very unlikely. That's not a TIA.
Great. Any other questions for Doc and Becky? Well, in the absence of any other questions, maybe some take-home messages, just recapping. So we'll start with Becky and then we come to you, Doc.
I'll leave the medical aspect to the doctor. I think I'll talk from the community aspects is if you know people that have had a stroke or you've got family members having a stroke, it can take a long time to recover, but recovery is possible and you might never ever go back to the way you were, but you can still live a very meaningful life. And there is a lot of support out there for people. And one thing that we're seeing, one thing at the Stroke Association we're working really, really hard for is to have better care for stroke across the whole pathway, right from the moment you have a stroke to however long it needs you to recover. I think that would be my key take-home message is it takes a long time, but it is possible to recover. And we absolutely believe people make amazing recoveries after stroke.
Thanks. Over to you, Doc.
Okay, so just to recap, so the important things to take home is that time is brain, and we know why strokes happen. We talked about the blood supply does not get to that part of the brain. So the brain is starved of nutrients and oxygen. And of course, it begins to die and the stroke symptoms happen. The quicker you restore circulation, the quicker you can salvage brain tissue and try to restore function. So we've talked about symptoms to look out for. And as soon as you notice it, get them quickly to any center that has a stroke unit. They can be seen by the stroke team and be offered reperfusion therapy, as we call it. So so time is brain is very important. Know your first symptoms. And if you've had a TIA, and even if it resolved very quickly, it's not a benign event, get down to be seen by, see your GP who referred to the stroke clinic, or you go to AN and make sure that, so don't treat it lightly. And also, the risk factors that you can do stuff about carry more weight than the ones you can't do anything about. So things like obesity, smoking, excess alcohol, hypertension, high cholesterol, diabetes, you can do stuff about this. So these are the things that you have to address, and you can minimize your risk factors by addressing this risk factor, minimize the risk of stroke by addressing these risk factors.
Thanks for that, Doc, because on Saturday, we had a young doctor and he shared his own experience of having, stroke. So clearly it doesn't exempt anyone, whether you are a medical professional or not. And that's why it's really important. So Doc, just to recap, because, and if that's okay, we will use this section for part of our vaccines campaign. So what you said earlier on, because one of our audience was talking about, someone having suffered stroke just after the second dose of the vaccine. So you're clearly saying there is no evidence, of a link between the vaccine and, and stroke. And also we know in our community, we always delay when it comes to engaging with services. So what advice do you have as well?
Now, not against with services, who knows what the reason that is? Is it cultural thing? Is that lack of trust or lack of awareness? I don't know, but everybody in the NHS is there to help. So obviously, if you do feel unwell, please assess your local services. Nobody's there to track you or to harm you or to cause you harm. They're all there to help. So if you please use your services. That's the first thing I would say. So there shouldn't be that lack of trust. And second, in regards to the vaccine, like I said, there's no evidence that the vaccine causes stroke. Like I said, because stroke is sudden onset, it could happen anytime. You could have a stroke while you're asleep, so you wake up with a stroke. It does happen. You can have a stroke while you're eating. Family members notice that, oh, you flopped your arms and you flopped your face while you vomit your. So it's sudden onset. So it could happen at any time, in any situation. So it could just be merely coincidence that you had a stroke after you had your jab. Not necessarily that your jab caused your stroke. So by all means, get your vaccines.
Thanks, Doc. I think we have a colleague who joined late, so asking how can you recognize the early signs of stroke?
Okay, fine. I'm happy to recap. So like I said, stroke can affect different aspects of your physiological functioning, whether it's weakness or sensation or vision or coordination or speech. So based on what part of the brain is affected. But quite commonly, based on the FAST campaign, the easiest and quickest assessment you can do is a FAST campaign. So first look at the face. Is his face lopsided on one side, as in does he have a facial droop on one side? As in one side of the face lower than the other side? But the face should be symmetrical ideally. Look at the arms. Are the arms weak? Can he move the arms at all? Can he move it minimally? If you can move the arms, can he keep his arm up compared to the good side? So that's your arms test. And also the speech test. Are they slurring their words? Are they speaking gibberish? Or is it that they cannot get their words out? And other symptoms, they tell that, oh, one part of their visual field is gone or affected. They can't see as well in one eye compared to the other. Are they incoordinated? Do they feel like they have lack of balance? They feel like they have no visual awareness, or awareness of the environment. Things like that are some of the signals you get in an acute stroke. So if you do see any of these things, like I said, call 999 and get them straight to a primary, to a hospital that has a stroke service, be seen by the stroke team and possibly referred stroke therapy. So the earlier you get them to the hospital, then the earlier possibly you can initiate treatment. Because you have a 4.5-hour window from when the stroke first starts. You have a clear onset time. Yeah, is that okay?
Is that okay? Any further questions? Okay. So in that case, I mean, this whole session has been live streamed, so it's on our YouTube channel. And just to say once again, massive thanks to Becky from the Stroke Association and to Dr. Osuno for making time and being part of, our awareness session tonight. Okay, I think we have, yeah, you can unmute yourself, Natalie, and ask your question.
Hello, everyone. Can you hear me?
Hello, Natalie.
Hello, doctor.
Hello.
Yeah, doctor. My question is, thank you tonight to let you all know about stroke. I know a bit about stroke, but that not too much. Yeah, my question is, before the fast, is it any early sign, like maybe 1 week before, or how your body reacts before that fast, before you can reach the stage of fast?
The thing with stroke is that it's, like I said, that definition is sudden onset. It doesn't happen gradually. There's no,
okay.
It is very sudden. So you can be fine talking normally, doing your normal activity, then in a split second, you've gotten your symptom. It is that quick. It is very sudden. So there's no build up to having a stroke.
Okay. Sorry, doctor. What's the difference between the stroke and the aracardia?
What, sorry?
And the how do you call that? Aracardia. I don't know that in English.
What, sorry?
How do you call that? Because there's a stroke and the cardiac arrest. Yeah, the cardiac arrest.
Oh, you mean cardiac arrest?
Yeah.
In the stroke, you're still conscious. In cardiac arrest, you could you're totally unconscious and unresponsive, and if you're not careful, can go on to die if they don't do good going CPR. That's the difference between a cardiac arrest and a stroke. They're both sudden onset, but in one case, you're totally unresponsive and unconscious.
Okay. Okay, thank you. Thank you.
You're most welcome.
Okay, once again, thanks everyone for making time. Please make sure you get the link and share it with your friends and loved ones. Thanks, Doc. Thanks, Becky. We look forward to working with you in future.
Thank you very much for inviting everybody.
Yeah, thanks a lot, Sam Charles, for inviting me.
Bye-bye.
Bye-bye.
Okay, thank you both. Bye-bye.
Bye-bye.